The coronavirus pandemic has caused the nation and the world to recognize the critical role that pharmacists are playing in the fight against COVID-19. From working in labs developing vaccines and antiviral drugs, to providing statewide advocacy and education, to serving some of the sickest patients in critical care units. The CU SCAG School of Pharmacy and Pharmaceutical Sciences is proud to introduce you to just a few of our pharmacists on the front lines. Dr. Joe Saseen, along with Dr. Doug Fish, both from the Department of Clinical Pharmacy, were handpicked to serve on the COVID-19 ECHO Colorado team. Dr. Saseen talks about his role on ECHO as well as his work in ambulatory pharmacy.
ECHO is not a new thing. It actually stands for Extension of Community Health Outcomes, and it's designed to get multiple interprofessional healthcare workers together to discuss topics, to share information with intent to improve health and sort of manage complex health issues. And I guess COVID-19 is a great example of a complex issue, but most importantly, in evolving issues. So the agenda basically is to have a 1-hour session 3 times a week with a different theme. The first theme that actually we did was medication management, to talk about some of the medication issues that are relevant because of COVID. So Doug and I led that first session, which sort of set an example for what we do thereafter. The didactic component lasts for the first half, with the other half being responding to questions from real clinicians out there in the field. Overall goal is really to provide information in a real-time resource. Some clinicians, you may just, I guess, imagine it that they may be out there and they may be the only clinician for a very wide catchment area. So to have some, I guess, colleague support from experts at the university is comforting to a lot of them. So our goal really is, in a nutshell, to improve patient care. But the way you do that, the way we're doing it, is by, I guess, empowering our clinicians and other supporters of clinicians with information. Pharmacists are essential workers, period. That's a great message. So for people looking for pharmacy as a field, that should carry a lot of weight. Look at this crisis and look who's out there in the front lines. It is pharmacists and other healthcare providers and a bunch of other people too, obviously, but we're part of that team. Because we want to keep our patients safe and we don't want to contribute to the spreading. So we are social distancing, but we're working telephonically and virtually, interacting with patients. We manage our in-baskets where we're still doing our share of what I call embedded care. Our providers, our medical providers, are sort of bombarded with acute issues right now. So they're triaging patients and they're seeing patients with symptoms, but things that we don't want to fall through the cracks are those patients with chronic illnesses like hypertension or diabetes or other conditions who need medication management and medication optimization or titration or routine evaluation. We're still doing it. Usually the biggest issues they're all related to medicines. Sometimes they're related to access, where a drug's on shortage or a patient is having a problem accessing their medicine because of cost reasons or something or another. But more often than not, it's really for the therapeutic decision making. So, hey, what's the next step? I already have the patient on this medicine or these 2 medicines, and they're partially responding or they're not responding at all. What do I do differently? Do I actually replace the medicine? Do I add one? Or my patient's having an adverse effect to this regimen. What's our next step? It's often sort of, we don't get many questions on what do I do for step 1? Because our clinicians know that, but we're really managing and helping out with the patients that are difficult to control in one way or another. There's strong evidence that pharmacist management helps control patients. It helps get them to their therapeutic goals. It's even so strong that it's cited with high-level recommendations in national guidelines like hypertension guidelines, cholesterol guidelines. So the evidence is out there. We're not waiting anymore. We just need to be bold and do it. So there's a broad acknowledgement that some of the traditional duties that have been in the realm of the prescribing physician that working in interprofessional teams can be done by clinical pharmacists, such as myself and my other team members and a whole bunch of other clinical faculty members that we have at the University of Colorado.